Health is a right, not a privilege. Health for Humanity believes that healthcare is a right that everybody is entitled to, wherever they live. Our aim is to work with marginalized populations in developing countries, providing access not only to healthcare, but also to the education and tools necessary to maintain good health.
And most people live on a diet of eggs and beans and tortillas, so they don't eat fresh fruits and vegetables, and they also lack knowledge about the opportunities they have to improve their health conditions.
We currently focus our efforts in Guatemala. This is one of the poorest countries with the largest indigenous population in the Americas, and it is here where indigenous communities and women experience great inequities.
Se sufre, viera. Yo he pasado penas con mis hijos, pero gracias a Dios ahí estoy.
We see a lot of people that have limited or no access to health care whatsoever. These sorts of conditions that we see when we're there, you'd never see people get to that certain stage of illness here in Canada.
Un hospital privado solo puede pagar a alguien que tenga un seguro o tenga mucho dinero, entonces no tendría mucho acceso.
Que los hospitales aquí son por una cirugía 30,000, 40,000, ¿quién va a tener 40,000 quetzales?
The indigenous populations have a lot of distrust because of the past, because of the Civil War, because of discrimination. They don't trust the national health centers. They don't speak the language. Often they only speak their indigenous language.
This is an area here with mostly dominated by sugarcane and coffee fincas, big commercial farms. So the majority of the people do not own land, live in conditions you could barely imagine. No water, no electricity.
Al ya no venir sería un caos porque mucha gente se quedaría sin cirugías, mucha gente no tendría acceso a tratamientos especializados como los tienen acá.
Porque sin ellos nosotros no podemos ayudar a la gente. Así de sencillo, si no vienen ellos, nosotros no podemos operar, no podemos hacer nada. Se colapsaría una parte del programa y no se podría operar a los necesitados.
There's a lot of international research on the determinants of health, like basic education, basic human rights, clean water, access to sanitation, opportunities for education, really basic things that we take for granted in Canada. People come for their operations, but they're coming with conditions that are preventable in their environments. And you can see the outcome of having your gallbladder taken out, but if you go home to an environment where there's violence, you're malnourished, you don't heal well, you go back where there's gender differences, and you're carrying the workload for the entire family, your opportunities for healing, your opportunities for health are really diminished.
The more preventative medicine that we can do, teaching into the communities, will help hopefully slow down what's coming into the hospitals.
There was a middle-aged woman that we operated on this year who sadly was a victim of domestic violence. She had been stabbed multiple times by her husband, who subsequently left her and left her to die, and by some miracle she survived. He had done other terrible things to her, and there are no social services here. One of the stab wounds that she had resulted in an incapacitating hernia, where it was very difficult for her to work, it was very difficult for her to even get around. The real difference is that the surgical problems that we see often go on for much longer than they would in Canada. So while the patient's health may be reasonable, the actual surgical problem is far advanced. Everything is scarred. It's a much more challenging operation. I mean, the reality is she has to go back to work. And now we know that she can do that and provide for her family a little better than she had before.
Any child that has a cleft lip has an associated nasal deformity. Sometimes it's severe, sometimes it's not, but this one is pretty significant.
we can do something that really will have an impact on this child's life on so many different levels. I mean, physically, emotionally, in terms of their confidence, their ability to hopefully speak and eat, everything.
H4H work is obvious when you think of individuals. I think if you think of the big picture and the huge need in the world and the inequities, it is overwhelming, it's immobilizing. So for me, I think I have to stay with that family.
We believe the right to health means not only providing corrective measures for those with failing health, but also providing access to preventative measures to avoid getting sick in the first place. We provide surgeries for patients who don't otherwise have access to them, but we also provide support for primary school scholarships, training for community health workers, and simple technologies like water filtration systems and wood-saving stoves. These efforts ensure that basic living conditions are satisfied in order to maintain good health.
Of course, children fall into the open fires on the floor, and respiratory diseases are one of their #1 problems. But going into the homes today, it was phenomenally different. The exhaust goes immediately right outside.
We've been providing funds for them to provide families in really rural areas with clean drinking water.
I'm not going to say that one workshop will change their outlook, but one workshop contributes to an environment where their outlook can change without it being a threat to who they are and to their basic identity.
El condón, eso protege no solo al hombre, sino que también a la mujer. ¿De acuerdo? A las dos personas. ¿Sí?
We were invited into one of the local living room areas where there were about 40 Indigenous women of all different ages on a mud floor in a smoky room with 2 light bulbs, and they were engaging with these youth workers talking about HIV prevention, basic information about it, and in their own language and in their own way they interacted with these workers. That was really moving.
I think it's the combination. Education, it's basic health, combined with all these other, these other factors, and we very quickly understood that education had to be connected with health and nutrition.
Por eso ahora mejor pienso, así, ¿verdad? Trabajar algo en que sea para mantener mis patojitos.
We're leaving behind some skills and some things that the people themselves can build on. And it's in time.
It's a very diverse group of people coming together to try to make a difference, broaden your horizons, and recognize that we have pretty privileged lives in Canada.
Everyone has the same focus, the same purpose when they come here, and I think if you have that common goal, you can't go wrong. Sí, que no nos abandonen, que continúen viniendo y que continúen dando siempre esa calidad de trabajo que ellos dan, que continúen con esa humanidad, ese corazón, esa bondad que ellos tienen para venir acá, no importándoles dejar sus familias, pedir permiso en sus trabajos o usar sus vacaciones para venir aquí.
We look forward to seeing them again. I mean, we come here and we see our friends. You're not really a tourist. For this 2 weeks, you belong here. You have a purpose here.
Que no es solamente un grupo médico el que viene acá, de doctores, de enfermeras, de anestesiólogos, que solo vienen y hacen su trabajo, no, es un grupo de amigos el que viene. Cada año que ellos vienen, nosotros sentimos como que ya vino nuestra familia otra vez.
Y aquí los esperamos siempre, Guatemala es su casa.
Health for Humanity aims to give people a better opportunity at life, not just to survive, but to live a life that's worth fighting to improve. Health is the first step.